Dermaplaning treatment will cleanse the client first. Use a gentle cleanser. And then we'll tone the skin. If your client is very oily, you could tone. And if you feel like this is still oily, you could go over with alcohol. If you choose to use alcohol, just to really dry those cells, start at the perimeter, not right under the client's nose. And then you want to make sure that the skin is dry, so you can take a tissue and just blot the skin dry before we start the treatment. Right, so we want to make sure that when you put the blade onto the handle, you see the little angle. You want to make sure that it lines up, and there will also be a number 10 that faces you, so you know you're on the right side of the blade. And then you just glide it in till you hear the click, and then you know it's secure. All right. So what I'd like to do is I like to start on the forehead, especially when you're learning, because that's a nice flat area. Now, the skin has to be taut the whole time. If you're working on someone, even like Jackie, who's younger, and their skin, there's not a lot of pull on their skin, still get into the habit of you working between your thumb and your index finger. So if you're a righty, 9 out of 10 times, depending on the area of the face we're working, you'll be using the blade towards your left thumb. The skin always has to be taut. So it's about like 1, 2, 3, 4, 5, 6 strokes per area. So I start here in the middle, and then I'll move up. So it's not a drag from here to here, it's just like in inch increments. And I can see she's a perfect model for this. So you'll see the hair, but where you see all the white, those are the cells that we're removing. So you want to also have, a piece of like a cotton swab or a cotton square on the side, so that you continue to clean off the blade. Now, what you really want to pay attention to when you're working on the forehead, of course, will be the eyebrows. So when I start in the center, we have enough space here that I can just pull and come straight up. But if a client has their brows are closer together, you'll have to come on an angle, because you have to remember the blade is sharp from here to here. So you want to make sure the placement so that you don't remove part of their brow. All right, so that's our forehead. And then I'll do the right side first. So I'd really want to just stretch the skin again. And you can see I'm moving, this finger follows me so that I keep this skin nice and taut. And then I'll come up on an angle. What you don't want to do is use the blade from here to here. You'd want to make sure that we really pull that skin up over the mandible. And I tend to work, I'll do the forehead, the right cheek, then I'll go to the left cheek, and then I'll work around the mouth area and the chin. If you're a righty, the left side, you do have to be careful and always pay attention if the client has on lashes. You want to come up from underneath on that first pass to avoid the lashes. If you have the access to move your chair around the bed, you can work from underneath. If there's anything raised on the skin, we want to make sure we go around it. Okay, so now I'll do the upper lip. So 9 out of 10 times we're going towards the thumb on the left hand. When you're working around the mouth area, that's when it changes a little bit. So first I'm going to ask the client to, pull down tight. And I'm going to come straight up. The other thing is, to make sure, of course, that we wear gloves during this treatment. And can you stick your tongue right there for me? So this helps to get into those little hairs right in the corner of the mouth. And she'll actually use her tongue, if I need her to kind of move the tongue along. And then we tighten it to really get those hairs right on that vermilion border. The blade is doing the work. You're not applying any pressure. Okay. And then depending on the chin, I can come up or I can also go sideways. And I'll just pull right underneath that mandible, just to get right underneath. Now the nose, most people don't need the nose dermaplaned. But if someone does have a little bit of buildup right in here, you just want to stretch it and just come over like this. I wouldn't do the nose until you feel very comfortable with dermaplaning. I would actually, sometimes I'll use like a touch and brow, or the tinkle on the nose instead, if you're not that comfortable with the blade. And it's usually just in the little nooks and crannies on the side. You just want to clean that out for them. All right, and then you'll look under a loop, just make sure we didn't miss any areas. That's why I like to I'll start on the forehead, right cheek, left cheek, perioral area, and then just touch up on the nose if I feel needed. And that way you have the same pattern every time you work on your client. So for the most part, this is the treatment, the actual dermaplaning. What I like to do after is, just in case, if you spent a little extra time on a client in one spot, This is an enzyme that I'll follow with, and it's an enzyme that is loaded with hyaluronic acid, a little bit of pineapple, but what it does is it will hydrate the skin and restore that lipid barrier that we just removed by dermaplaning. As long as you can share with me the ingredients in some of your products, I can tell you which products you can use with dermaplaning and which ones we wouldn't recommend with dermaplaning. You know, you always want to start, you know, with the mildest, the first treatment, and then when a client comes back, then we can add to it. I love to use ultrasonic with this treatment. I'll do the ultrasonic right before I do the dermaplaning. And then I like to finish with LED lights. So this can be a very basic treatment where they come in, they dermaplane, you can SPF and out they go, or you can make it a nice relaxing treatment, which is really what I recommend. You could do a finishing mask, you know, after this treatment, you know, just for the sake of that with filming. I'll just, at this point, I'll do a couple of serums. And then SPF, and then treatment's finished. Most clients book this treatment every 4 to 6 weeks. The main function of this treatment is really to exfoliate the cells. So it's even safe for, you know, pregnancy. There's no, you know, acids involved. But the bonus is the removal of the vellus hair. And then we'll finish with SPF. You could do an eye cream, you could do a lip treatment, however you want to finish it off. Okay, she's all set.